Well, folks, it is time right now to stop burping your baby if you're doing it.
Now, that's according to Dr. Pamela Douglas, an expert with 20 years' experience studying baby feeding habits. And Dr. Douglas is busting some very common myths surrounding newborns, and she joins us now. Good morning to you, Pamela.
Good morning.
Now, you're basically dealing with that very early part of both for parent and child of a newborn's life. And I'm wondering why you wrote the book, because there's so many books out there already.
That's absolutely true. So why add another book to the mix? There's a lot of information out there about these first sensitive 4 months when babies can cry and fuss a lot. But the problem is that so much of the advice is conflicting. And that's not only confusing for new parents, it can actually be quite disempowering during a time that's already going to be stressful and exhausting. So I've written the Discontented Little Baby book with the aim of really helping parents to enjoy their little baby as much as they possibly can, even though the baby's crying and fussing. And I aim to do this by, firstly, looking at the evidence and debunking some of the myths that are out there, by looking at common problems that can actually make crying and fussing worse, but are often not picked up or misunderstood. And I look at cued care, which is about sensible responsiveness to your baby, even though you can't always settle your baby by responding. And I also am interested in offering parents some strategies for helping to manage those difficult thoughts and feelings that really will often arise if our baby is unsettled.
Like, get me the hell out of here, which is quite often.
That's right.
In all seriousness, though, when I remember had our first, we went in search of that golden egg, and we found it in a book called Baby Wise, which was terrific for us. In terms of the way that we're getting the baby to sleep in that regular routine. However, there are that many out there. Let's go through through some of the myths that you help break down. That is that babies, parents should teach their baby to sleep, and you say that's false.
Well, look, if something's working for you, I say stick with it.
Yeah.
But sleep is actually a hardwired biological process that can't be forced or taught. And so what really matters is that we remove the obstacles that can get in the way of the healthy function of the two biological sleep regulators. So examples might be, say, feeding problems that aren't picked up. Or an example might be the advice that we tend to give parents to sleep babies for long periods in quiet, dark rooms, which really can mess with their circadian clock, which is one of the biological sleep regulators. So once we remove those obstacles, in fact, we can pretty much trust that the sleep regulators will do their job without undue effort on our part. But we do have to remember that baby's sleep needs are highly variable. So believe it or not, your baby might need half as much sleep in a 24-hour period
as
the baby next door, and they're both normal and healthy.
All right.
They're just at opposite ends of the spectrum.
Okay, let's go to the next one. We've got a couple more we want to whip through. Back arching is commonly associated when a child may have reflux, but you disagree with that?
Well, the very first thing I would say is that if any family has a concern that their baby has a medical condition, it's really important that they talk that over with their own doctor. But what I can also say is that the evidence shows that feeding problems in the first weeks and months of life are often not picked up. And I know from my clinical practice and from the field of infant feeding that back arching at the breast or bottle and pulling off or fussing actually very often signal feeding problems, and once you deal with the underlying problem, everything settles down.
Go to somewhere like Tresillian.
I want to ask about this one importantly too. This burping thing is interesting to me.
Yeah.
Because at some time, all of my kids had a little bit of reflux going on. It's a practice performed by all newborns around the world, but you say it's completely unnecessary. Is that right?
Well,
like a little bit of whack on the back?
If burping works for you and your baby, again, I say stick with it. But most cultures don't actually practice burping rituals, and in fact it seems to have spread with the British Empire because babies actually relieve themselves of air naturally. And what concerns me is that burping practices can actually disrupt that lovely hormonally induced sleepiness at the end of feeds, which allows the biological sleep regulators to kick in.
Okay. Fascinating stuff. Well, the book is called...
Right
Just
there.
got it on the front right there, The Discontented Little Baby Book. As we say and as we've shown, you do bust some myths. So hopefully it's going to answer a few questions for new parents who are struggling with newborns that aren't quite doing what they're meant to do.
Thanks, Lisa.
Thanks very much,
Well,
Pam.
that's only 4 topics and plenty more in there. Well done, Steve. Thank you.